It is a great satisfaction to greet you again. I hope you and your pet are well. Today we will talk about the following. Dogs can also suffer from bronchitis. A common cause of persistent cough in dogs is chronic bronchitis, an inflammatory disease that affects the upper respiratory tract and causes coughing for a long period of time. Knowing how the disease occurs will help you know how to control it. 1. What is bronchitis in dogs? Canine bronchitis, or tracheobronchitis, is a disease characterized by persistent coughing for more than 2 months. Strictly speaking, any sign of cough that is attributed to an underlying cause, such as viral and bacterial infections or systemic diseases in dogs, cannot be classified as chronic bronchitis. It is necessary to rule out other possible causes of persistent cough before reaching a diagnosis of chronic bronchitis in dogs. Chronic bronchitis is an inflammatory disease that causes changes in the lining of the upper and sometimes lower respiratory tract. These changes cause excessive mucus buildup and production that, if untreated, can progress to serious respiratory disease. The severity of cough seen in dogs with canine chronic bronchitis waxes and wanes during different times of the day or seasonally. There are times when the cough is so severe that respiratory distress in affected dogs is evident, and times when occasional coughing is seen without any signs of systemic or serious illness. The disease is seen in middle-aged and older dogs. Young puppies with a chronic cough usually have a specific underlying cause, such as a respiratory infection. However, there are diseases in older dogs that can manifest as chronic cough, such as heart disease and metastatic cancers, that should be ruled out first. 2. Symptoms of bronchitis in dogs. Persistent, strong cough is the most common sign associated with canine chronic bronchitis. Cough is the body's response to pathogens and external irritants that have infiltrated the respiratory tract. When a certain irritant or pathogen infiltrates the respiratory tract, the lining generates an inflammatory response and produces mucus secretions to try to trap these pathogens and prevent them from affecting the lower respiratory tract and lungs. Coughing is the body's way of clearing the buildup of mucus in the respiratory lining. In the case of chronic bronchitis, since the inflammatory changes along the lining are almost always permanent, the airways continually produce mucus and the cough in affected dogs becomes persistent. The cough is usually more intense when there is a sudden change in the dog's environment, after the animal has rested or at the beginning of any physical exercise. As the disease progresses, wheezing is heard in affected canine patients. Breathing difficulties and exercise intolerance are also common signs of severe chronic bronchitis in dogs. Nausea and vomiting can also be considered a complication of severe coughing fits in dogs. Loss of consciousness is occasionally observed in patients with a strong, persistent, forceful cough. 3. Causes of bronchitis in dogs. To date, the specific underlying cause of canine chronic bronchitis is still unknown. It is suspected that chronic exposure to allergens and environmental irritants may be a predisposing factor. Older dogs are at higher risk of developing the disease and all breeds can be affected, but small breeds are more likely to develop bronchitis as they age. Common environmental irritants and stimulants thought to trigger or contribute to the development of chronic bronchitis include the air pollution, cigarette smoke and vapor, allergens such as pollen, dander, and grass, aerosols and household cleaners, dust, bacterial or viral infections. Chronic bronchitis in dogs is not contagious. Transmission is not possible between the affected canine patient and other dogs, species, or humans. 4. Treatment options. Since chronic bronchitis is a progressive disease, treatment aims to control clinical signs and delay progression. This is an inflammatory disease and, as such, anti-inflammatory medications are an important component in the treatment and management of the condition. Systemic corticosteroids such as prednisone and prednisolone are very effective in controlling inflammation and relieving symptoms associated with the disease. Steroid inhalants, such as budesonide nebulae, are an alternative. These types of medications can be equally effective in controlling airway inflammatory responses with minimal side effects. Controlling exposure to environmental irritants such as air pollution, smoke, and aerosols can further help manage signs of chronic bronchitis in dogs. Keeping your dog in well-ventilated spaces can help reduce the inflammatory response in the dog's airways. It is a pleasure to inform you and help you. If you have not subscribed to the channel, you should do it now. Take care of yourself and your furry friend. A hug, and until the next video.